Good evening, ladies and gentlemen. This is USMLE videos. Welcome once again to our channel, and as always, I request you to visit our website at www.usmlevideos.net. That is www.usmlevideos.net, where we have posted hundreds of videos explaining thousands of most important points you must know before you take USMLE examination. Let me talk a few minutes this evening about complications of sinusitis. Sinusitis, as you know, is the infection of sinuses. Now, these sinuses are in close proximity to many organs in the skull, like the eyes, then the brain, then the bones. So remember these things. You will get so many most important questions from this topic. So it's very important to know these things. First of all, orbital complications. You see, the ethmoid sinus here is so close to the orbit. In fact, the papyraceae of ethmoid bone, in fact, it is so like paper thin. It separates the medial part of the orbital canal from the ethmoid bone. So it is very easy to cross this barrier, and the infection could go into the orbital canal and cause several complications. Now, the other thing we need to think about is the ophthalmic venous system and the ethmoidal venous system. So infection that goes into the ethmoidal venous system could easily go into ophthalmic venous system because there are no valves between these groups of venous complexes. Because there are no valves, the infection could easily spread into the orbit. Now, once the infection goes into the orbit, it might cause different problems. Number one, when the infection goes to the front of orbital septum, it causes lydedema. When it is behind the orbital septum, it causes orbital cellulitis. So either way, it causes problems. Then if sometimes the pus, it stays below the periosteum of the lamina papyracea, then it causes subperiosteal abscess. The other thing, orbital abscess, pus collection in the orbit. And fifthly, cavernous sinus thrombosis. The infection from the ophthalmic veins could go back into the cavernous sinus. Then it causes life-threatening complication, cavernous sinus thrombosis. So basically, those are the 5 most important orbital complications. Now, extraorbital complications. The first thing we need to think about is meningitis. The infection from the sinuses could go into the meninges and infect the meninges and causes meningitis. In that case, Brzezinski's sign, Kernick's sign becomes positive. You need to do a CT scan with contrast, CT scan of the brain with contrast, and a CT scan of the sinuses to see the extent of the disease. And how to treat these conditions. I forgot to tell you, when the patient has lydedema, treat with oral antibiotics. When the patient has orbital cellulitis or orbital abscess, you need to start them immediately on intravenous antibiotics. When the patient has subperiosteal abscesses, you should do surgical treatment for drainage of the sinuses. Similarly, for cavernous sinus thrombosis, the mortality rate is very high in spite of both intravenous antibiotics and drainage of the sinuses. Even for meningitis, you immediately start intravenous antibiotics and surgical drainage of the sinuses. Then the other important complication is epidural abscess. The infection from sinuses might pass through, and it goes between the skull and the dura. Then it forms epidural abscess, and the spread could be by direct extension or hematogenous spread. Either way, it finally causes brain abscess. In those cases, long-term antibiotics are necessary, and the mortality rate is very, very high. Then cavernous sinus thrombosis, as I mentioned earlier, it is because of the spread of infection from the ophthalmic venous system into the cavernous sinus. You should immediately start the patient on intravenous antibiotics, and involved sinuses should be surgically drained. Patient in fact goes into chemosis, slugged pupillary response, and also ophthalmoplegia and blindness. So when those symptoms comes, those are the indications of a very severe cavernous sinus thrombosis. And finally, let me give you the one final complication of sinusitis, pot puffy tumor. Pot puffy tumor, when the infection in the frontal sinus spreads to the frontal bone, it causes osteomyelitis of frontal bone. As it causes osteomyelitis of the frontal bone, the forehead becomes like a Duffy swelling. So it becomes like a swelling around the forehead. We call it pot puffy tumor. So pot puffy tumor can also happen as a result of sinusitis, as a complication of sinusitis. So basically, orbital complications: lid edema, orbital cellulitis, orbital abscess, subperiosteal abscess, and cavernous sinus thrombosis. Then meningitis, epidural abscess, brain abscess, pot puffy tumor. These are the most important complications of sinusitis. You can leave your comments on our blog and visit our website at www.usmlevideos.net for more videos as you prepare for your USMLE examination. Thank you. All the best.